Welcome back to the podcast, Metacognition Mondays with Antony Lo. This week, we are looking still in season 1, the foundations of metacognition. This is episode 4, the role of metacognition in learning. Learning is really more than absorbing information. It's about managing how we engage with and reflect on that information. So in this episode, we're going to explore how metacognition enhances learning in clinical education, patient care, and professional development. We're going to explore these 3 different topics: deep versus surface learning, self-testing and feedback loops, as well as learning from errors and uncertainty. So looking forward to sharing all of this with you. Please make sure that you like and subscribe, and let's get stuck into it. Deep versus surface learning. Surface learning is that rote memorization. It's about that passive intake, that lack of connection to the application. It's the memorization of things like muscles and joints and ligaments, to be able to name them, but not how to apply what that means. The deep learning is about making meaning. It's about connecting those concepts and integrating the theory with practice. So metacognition supports deep learning by simply prompting the awareness of one's learning goals, reflecting on what is understood versus what is misunderstood, and active engagement with that material. By making sure that you're aware of what your goal is, for example, an anatomy exam, you need to know things, you need to be able to name them. It's very important to do that. That's the rote learning part of things. But what's much more important is knowing and understanding how an individual muscle, and muscles don't work on their own. They just don't isolate. It's understanding how that's working together with others, how the combined actions and reactions of the body integrate into producing a movement that is desired or undesired. And then there's lots of misunderstandings about what's out there about different things. So being able to do the deep learning using your thinking about thinking, the metacognition, this is important. And then it's about that active engagement with the material. I don't know if I've shared the story before about the student who just wanted to learn that list of muscles because they had an exam. It was a very short amount of time, and they basically just had to do that. Ideally, to study for anatomy, you would draw on yourself. You would understand those relationships. You would look, I tell people, your body is your anatomy textbook. You can take it into the exam and you can do the movements and you can remind yourself. It's that active engagement with the material that's so important. That's why I loved anatomy labs, to be able to touch and feel and pull on different tendons and see what happens and how it happens and the sliding. One particular example I remember from the anatomy lab was coracobrachialis. Now, this person's coracobrachialis was attached, like, I did not realize that it was attached to their short head of biceps. In fact, you couldn't really distinguish between which muscle was which, except for the fact that the tendon ran off a bit differently. Otherwise, it was like it was the same muscle. So being able to engage with a body and see that, and then blunt dissect it and see the different muscle bundles, that was super important. And that gave me a deeper appreciation for how the different muscles can interact with each other. Now, clinicians and students who use metacognitive strategies, you're going to learn faster. I don't mean remember faster. I mean learn faster. You're going to be able to retain more. Using these metacognitive strategies are going to help you remember what you've learned more. And then you can apply the concepts, because when you learn a protocol or a procedure or a recipe, if you don't really truly understand it, then it's hard to apply it to the context that you're in if you only learnt it to apply in a particular context. So an example is memorizing the stages of tendinopathy. That would be the surface level of learning. A deeper level of learning might be how somebody compares different stages and how they present in real life, what they look like, how you can see the presentation, what it looks like differently on real-time ultrasound. To be able to see what healing looks like and how the scans reflect what is or isn't correlating with those things, and why sometimes the scan results don't matter. Like, all of these things are a deeper learning about the topic rather than just saying, okay, these are the stages. Another example would be understanding about central sensitization and how that can affect, and the role of nociception in that. Another example might be understanding how to grade, I don't know, ligament tears or muscle strength testing. But you can rote learn what they are, but understanding why and how and what influences strength testing, for example. Is it pain inhibited, or is there truly a muscle tear, or is there some neurological deficit? There's a whole bunch of things that go into why that might be deeper. So we want those. Now that we've looked at deep and surface learning, why don't we look at self-testing and feedback loops? So self-testing is obvious. Self-testing is self-testing, and feedback loops is being able to take the result of something and change the way that you do it next time to try and get a result that is closer to what you want. And metacognitive learners will test themselves all the time and interpret the feedback in a constructive sort of way. Sometimes I do just wish things went smoothly, and those days are nice, but those days get boring. I love, I referred to jazz last time. I referred to music. I love the variability that comes, the freshness that comes, not just the comfort of familiarity. It's important. Right, some self-testing examples. For example, quizzing yourself before you review your notes. I think that's important. It's one way that you can do it. It's actually the way that I learned things, was I tried to say it before I looked at it, and then I corrected it, and then I started again. I can do rote learning, believe me, and then I can forget it the next day, and I'm being serious. Summarizing a concept from memory. This is important. This is also the most vulnerable. I would love for people to feel so comfortable that when I ask them about a principle that I've taught them, that they could just say it, and if they get it wrong or if they get it right, it doesn't actually matter. It's the fact that I'm asking, and then it's that feedback loop of being able to go, oh, okay, that's that concept, and that's what this means. That's the type of thing that you might want to do. You might want to quiz yourself on that. And then teaching it to somebody else. Teaching is one of the best ways to retain what you've learned. And apparently you can teach a dog, you can teach a pot plant about these things, and it is still better than trying to sit there and just do it in your head. It's very important. So continue to self-test in these ways. Now, feedback. This is most powerfully done when you follow it with a reflection. So if you're going to get feedback, to be able to reflect on it and then implement it is the best thing to do. So what did I get wrong and why? I like to ask people to give me at least 2 stories about why whether you got it wrong or got it right. For example, you did this treatment technique. Why did it work? And people have the one reason. Well, I thought that they needed mobilization, and so I loosened up the joint with a mobilization. Of course. And it's like, okay, good. What's another reason why it might have helped? And that's when people get stuck. And this is that metacognitive process, right? This is the reflection that I want. Okay, well, what is another reason why it might have worked? It might have been that they felt safer and they relaxed, and that allowed the joint to move more, which I interpreted as I'm freeing the joint up from the adhesions that were there. Or maybe simply touching the person caused a relaxation of the muscles. Or they got stiff, they got more stiff. Why? Well, because it provoked their pain, and so they got tense. Okay, what's another reason why? Do you see what I mean? This is important. Was it a knowledge issue that caused issues, or was it a process issue? So did you not know something? Like you didn't know about this particular technique, or you're just guessing, you made it up? Is it a process issue? You know the thing and you applied it incorrectly. These things can happen. I asked somebody to show me their figure 8 bandage, and yeah, didn't look good. That was a process issue. A little bit of a knowledge issue. They got the crisscross right, but they didn't overlap the correct amount. They didn't start distal to proximal. Like there was a bunch of things that went on there. But it's that reflection of, is it a knowledge issue? Is it a process issue? Is it a different issue? Was it just nervousness? Who knows? So metacognition helps the clinicians distinguish errors of fact from errors of strategy. You can have a factual error. You might, like I have caught on radiology reports, people not reporting on things. That's a lot of that happens. Or, they, that to me would be like an error of fact. So I would bring the radiologist and say, hey, you're the radiologist, not me. But on this slide, is on this image number of this set, is that an end plate fracture? And they go, oh my goodness, yes, it is. I didn't report that. Or they might go, no, because of this reason. Oh, that's a normal variation of this. Or I might ask, okay, are they modic changes that I'm seeing there? And they might go, yeah, but not really, because on this scan, you can see that it doesn't correlate. And for that to be a modic one, it needs to be this and that. Like, whatever it is, they're errors of fact. Thinking about and reflecting about what's going on will help you distinguish those errors from errors of strategy. The facts were right. How I applied that knowledge and into what I did, that might have been an error of strategy. And so now we're fine-tuning into how thinking about your thinking can change and give you more granularity, more clarity about how we're going to change. So that feedback that you get can be both external, so somebody else watching you, your peers, supervisors, the patient, versus external. It can be external. So that's going to, internal. That's going to be your self-assessment. You need both. And that's why it's really important to be able to be with people where you can double check. For example, quite often, either me or my friend Hubert, who I work with, we might have somebody on a Monday who has come in and on the weekend, they did knee injury. And we think, oh, this is an ACL. We do all our tests. And then he might come to me and say, hey, I've got somebody who's just on an ACL. Can you just do a Lockman's and pivot shift and tell me what you think? Okay. So I go and I say yes or no. And I'll do the same for him too, because it's within that first week. Like, we need to know if we're going to start talking about a operative approach or a non-operative approach, and the pros and cons of both, and whether or not we need a scan to see if they're the right type that's going to be really good for the non-operative approach, and all the rest of it, right? Is there a meniscal tear? Are there other things that mean that they're not suitable for it? There's a lot of things that go into it. So being able to have that external feedback from a peer, like my friend Hubert, is so important. And that internal one, to be able to go, okay, let me talk to the surgeon about why this might not be a good conservative non-operative care one, or why it needs to be. And I thought that it shouldn't, like why it might need to be surgical and not. So being able to have that internal and external feedback is really important. And that loop of being able to change how you do things later is important. So regular feedback loops do support continuous and adaptive learning and not just evaluation. Right. We've already covered deep versus surface learning and self-testing and feedback loops. So learning from errors and uncertainty, the fun one that people always hate. So error-based learning is one of the most important and most powerful forms of growth. Metacognition reframes mistakes as opportunities to understand. In the realms of positive psychology, positive self-talk, people don't like calling things errors. They're opportunities to understand. I don't have a problem with calling things what they are. It depends on what the meanings are. So just remember BAMs that I talked about in a different episode. I think it was the second episode. Beliefs, attitudes, meanings, stories, and bars are biases and assumptions. It's the meaning that counts. Mistakes happen, like something wrong was done. You made a mistake, an error of some sort. It is an opportunity to understand. It is important to do that. What was I thinking at the time? What led me to make this mistake? What did I miss? Where did I go wrong in my reasoning? And quite often when I think about what I'm doing, it's because I got too focused on something that was obvious. And a common one would be referred pain from the back to, say, the knee. And the person gets better. Like on all measures, they get better. But in the longer space of time, they're not getting better. They're not necessarily staying still, but they're not getting better, like they're not improving their functional goals. They still get the pain that comes back over time. It's like, okay, what's my reasoning? And usually we don't send for scans until a certain amount of time has passed. And so we're getting close to that. And you've got to reflect, okay, well, maybe it's both. Maybe I am moderating pain through the spine, and for whatever reason, there is that component from the spine. But what if they just are irritating their knee as well, or it has damage, and you send them for a scan and they're grade 4 cartilage changes, like they've got no cartilage in some parts of the joint, and it correlates to their pain. And like, you've got to go back and rethink, okay, make sure that I don't miss this. It can be both. Don't get distracted by the fact that you can get them from unable to squat to being able to do 10 squats with load without pain. Like, that's possible. But it doesn't mean that it's a guarantee that it's just referred pain from the back, you see? So metacognitive learners will lean into that discomfort and reflect on that uncertainty because it's important to do. Being able to do reflective learning includes things like keeping an uncertainty log. I don't keep these logs, okay? I don't write things down. I'm going to let you know now. But that some people do find that. I do sometimes write down things I want to find out more about later, or I just open a tab and I start the Google search and then I leave it there so I can come back and go, oh, yeah, that's right. I was going to look at that. Peer case discussions. It happens on Facebook, it happens private message, it happens in person. But these are important reflective learning tools. And revisiting flawed assumptions. It's uncomfortable. I hate being wrong. If anybody knows me well, you know that I hate being wrong. Most people hate being wrong, right? People hate it. How you react to that? Well, I try to make sure not to be wrong about that again, right? I think that's the healthiest way to do it. Like, accept that I'm human, that I make mistakes, I am trying my best. All of those things are fine, but also, like, try not to make that mistake again. And the benefit of reflective learning means that you will become resilient, because there's nothing more taxing than feeling like you're under attack, but surviving it. That breeds resilience. It's also humility. You get humbled by your mistakes, and I think it's important. If I think that I've reached a stage where I'm not making any mistakes, I think I should retire, because I've blinded myself to the fact that I am human and I will make mistakes and nobody's perfect. I need to retire if I ever think that I'm not wrong at anything. And, you know, this reflective learning will help with your adaptive reasoning. The more you practice, the more you can branch in real time, hold many different diagnoses and possibilities at the same time without being overwhelmed, and being able to work towards the end goal for what the patient wants, what we want, and be able to do that smoothly while telling jokes and telling stories and listening to them and having a chat. So what have we covered today? We've looked at the role of metacognition in learning, and the deep versus surface learning, and why rote learning is the surface learning, and how to consider to start some of that deep learning, how to put it into practical application. We looked at self-testing and feedback loops and why it's so important, and how to do some of that, as well as learning from errors and uncertainty, the painful, uncomfortable work of self-reflection, especially when we've made mistakes. It's always easy to do a post-mortem on a brilliant game that we've done, or a case that we've done where we had total success and guaranteed and all the rest of it. Always fun to do them. It's not fun to go over the ones where you made mistakes. So that call to action is going to be revisiting a recent mistake or a moment of uncertainty. This week, I want you to think about what you learned about your thinking from that recent mistake or moment of uncertainty. It's okay to be uncertain. It's important. How did you respond? How did you think? What were you feeling as well? And how will you apply that insight next time? I think that's important. What's your plan for the next time this type of thing comes up? And I say type of thing because you need to apply it in different contexts. It may not be this particular case presentation that you see again ever, but it's the error in thinking. It's the opportunity to learn and grow from that difference in thinking, and making sure that you think more broadly and inclusively, so that you don't go down narrow paths that are leading you into trouble. So please leave a comment. Let me know instances of surface learning, deep learning, self-testing, feedback loops that you have, and any errors or uncertainty, and how you've learned from them and applied them, and how you've improved from them, and how you keep going through this cycle. I want to know more about that. So please leave a comment, like and subscribe to help this podcast. You know, more thinking needs to be done out there in the healthcare and fitness world. And I want to be a part of that. That's why we're doing this. What's in the next episode? Metacognition and clinical reasoning. So it should be a doozy. I'm looking forward to catching up with you there, because clinical reasoning isn't just about knowledge. It's about knowing how and when to use that knowledge that you have. I'm looking forward to it. My name's Antony Lo, the Physio Detective. And if you like my style, you like my content, and you're interested in making the complex simple, then come find me at antonylo.com. Cheers.